Talking Show right here on TTT, also on Talk City 91.1 FM, and streaming live on Facebook at TTT Live Online. Now, today, September 10th, is commemorated internationally as World Suicide Prevention Day. With me this morning from the Ministry of Health is Ashwini Nath, who is the manager of the Mental Health Unit. Also with me is Colleen Braffett, who is the Mental Health Planner of the Mental Unit. Good morning and welcome.
Good morning.
Morning.
Now, this is a big deal, suicide prevention, and we saw some statistics earlier that 800,000 people die per year as a result of suicide. Do you have any figures in Trinidad and Tobago?
Yes, we do. So we have our rate for suicide. The 2016 figure is that we have a rate of 12.9 per 100,000, and this is both above the global and the regional average. So it's quite high. We have sixth in the Americas for suicide rate. So we have a major public health problem happening with regards to suicide. It's
Definitely.
quite common. It's more, in terms of figures, the Global School Health Survey was also done. And this is a survey that surveyed forms 1 to 6 in our adolescent population. And it was representative of all the secondary schools in Trinidad and Tobago. So just over 2,800 students were surveyed. And it looked at different health behaviors, and it asked how many people were contemplating suicide. And 22.9% of the sample, which is quite alarming, said that they were considering suicide within the last 12 months. And 14.5% said they actually attempted suicide within the last 12 months after that survey was done in 2017.
These are some startling figures, and over the years, I myself have lost a number of peers and friends as a result of suicide. So something that hits close to home. So these figures that you said, we are 6th in the Americas.
Yes.
What are some of the main causes or reasons, that from your studies and from your research that you have encountered that people may have tried or successfully committed suicide?
So that's the first thing. We want people to know that suicide is more complex than simply having a domestic dispute, because we see a lot of that plastered in the newspaper. However, there are a lot of different risk factors, things that put people at risk. So for example, depression and mental disorders is a large risk factor for persons who might consider and contemplate suicide, largely because they may not access healthcare early, or they may not have social support. Alcohol use and substance use, that's another risk factor. So persons who find themselves overindulging, that can make them more susceptible to suicidal behaviors. We have a lot of different things, economic challenges. So we heard some stories about persons who were recently retrenched who would have attempted suicide or would have died by suicide. So significant loss, grief, especially in the absence of protective factors. That's people you can talk to and be vulnerable with and feel safe with. We don't have that. So that's one of the things we want to talk about today with World Suicide Prevention Day. The little that you can do is to listen. If you feel that someone may be contemplating or talking about ending their life, or they're fed up, or they're feeling like a burden, one thing that you can do is just listen and and kind of just acknowledge their pain and their deep grief.
Yeah, some heavy words there. Again, being able to listen and to be kind.
Exactly.
And just not have these preconceived notions in your head that, hey, this person wants to commit suicide because of this specific reason that that you are accustomed to hearing. It's, as you were saying, it's a lot more complex than that.
Yes, lots of different factors come together.
Yeah, so what is the Ministry of Health doing to commemorate World Suicide Prevention Day?
So if I could just talk about what we did last year. So last year we would have launched our media guidelines for reporting on suicide. And this is 11 best practices for how the media can report, because one of the evidence-based interventions for suicide prevention is responsible reporting on suicide. But we didn't want that to happen in a vacuum. And actually we've seen some improved reporting from our journalists. So we want to commend the media for improved reporting on suicide. And we've actually seen a reduction in the rates. We don't know if it's related, but there may be other factors involved, of course. So this year we want to create a national suicide prevention strategy. So there's an entire framework that this is operating within. So we're looking at 4 different action areas for the suicide prevention strategy, looking at governance and leadership. We're looking at our health systems response. We're looking at promotion and prevention. And finally, we're looking at improving our surveillance systems around suicide. So we'll be having a technical consultation later today at the Trinidad Hilton, where we invited different ministries and the RHAs to come and consult on this strategy. So this is how we'll be consulting on it this year. And following this consultation, we hope to take this out to other NGOs and to the public as well, because every single person has a role to play in suicide prevention. We really want to underscore that. There are things that anyone who's listening right now can do in terms of, like Colleen said, listening. if you think or suspect someone may be suicidal, don't be afraid to ask. I think one of the biggest myths is that if you ask someone if they're suicidal, that will actually encourage them to die by suicide. But it creates that space for them to talk. It actually gives them the time to reflect and not act impulsively. So it's something that we want to encourage this morning.
Yeah, and as Rishi and I were just briefly speaking about earlier, you know, it's way more complex. It's not just a straightforward thing. You know, a lot of thought had to have gone into the process before somebody took that type of action.
Absolutely.
You know, and so having these forums and the things that the Ministry of Health is making available and consultations, you know, it will go a long way. And moving forward with the plans, it will definitely be beneficial toward at least decreasing the rate and you know, addressing these core issues to help lower it even further and hopefully one day even eradicate it in Trinidad and Tobago. Well, that's all the time we have for today, unfortunately. But again, this is at the Hilton later today. This is a consultation, not open to the public.
Not open to the public.
Not open to the public.
Not yet.
But again, big topic and something that definitely needs work in the vineyards daily.
For sure.
All right, so I want to thank you so much, Asvini Nath, Manager of the Mental Health Unit. Thank you so much, Colleen Braffett, Mental Health Planner of the Mental Health Unit as well.